I became very interested in two things that I'm going to talk to you all about tonight. One is nutritional genomics, and that'll be the subject of my next book that'll be out next January. And the other is toxicogenomics. Toxicogenomics is the study of how various environmental toxins cause cancer and how it happens over a period of decades. You know, one of the major things that Deborah and I have both realized over the years is what is in our external environment. The environment out there becomes the environment in internal environment. It becomes what's inside you. And so, you know, we've really encouraged people, everybody has to become an environmental activist, only because your health and your children's health, your grandchildren's health, is completely dependent upon what's in the air that you're breathing, what's in the water you're drinking, what's in the food you're eating. And what you can't see doesn't mean that it's not there. Because a lot of people really think if you can't see it, that it's really not there, and we know nothing could be further from the truth. And as an oncologist, I became very, very interested not only in treating cancer, but helping people reduce the risk of ever getting cancer in the first place. Now, we're living in a country today where 1 in 3 people are going to hear the words, "you have cancer." Unfortunately, when I first started about 25 years ago, the statistic was 1 in 3. They predicted by 2050 that it was going to rise to 1 in 2. We're almost there now, so we're ahead of schedule. So if that's not an epidemic, I don't know what is. And we've got a lot more people surviving cancer, but there are a number of types of cancers like childhood brain tumors, again, which goes along with what Deborah's working on, is increasing significantly over the last 30 years. 1 in 7 women will develop breast cancer. Some people have said that's due to earlier detection, which is part of it. So a lot of people think that if you're going to get cancer, if you're going to get Alzheimer's, if you're going to get a number of these diseases that develop in life, that it's just bad luck or bad genes. But the fact of the matter is they've looked at identical twin studies. This was in the New England Journal of Medicine. Identical twins develop the same disease only 10% of the time. And when you look at the most common types of cancer, like breast, colon, or prostate, identical twins, only between 15 and 30% of the time will they get the same disease. So a lot of it has to do with the environment. And one of the key things I'm going to talk to you about tonight is it doesn't just have to do with the genes that you're born with. Okay, you have the genes, you know, half from your mother, half from your father, but you can control gene expression throughout your entire life based on the nutrients that you're putting in your body or the toxins that you're putting in your body. Next. Now, this is a little bit of a technical slide, but it illustrates a point very well. So the yellowish fat mouse you see up there is the mother of the thin, dark brown, normal colored mouse right next to it. And this study was done at Duke University by Randy Jertle, and it really illustrates the whole point I was making about what we call epigenetics. So it's not about mutation, it's not about DNA damage, it's about affecting gene expression. So that mouse is called an agouti mouse, and it was bred so that it has a very yellow, pale skin coat. It becomes obese at an early age. It becomes diabetic at an early age. And they develop a number of different tumors as they age. So they have a very short lifespan. When this mouse was fed extra things during the pregnancy, like betaine, which comes from beets, B12, folic acid, it started giving rise to more of the normal phenotype mouse, the normal mouse that is thin, does not become diabetic, does not become cancer. And the fact is that's heritable. which means that mouse can continue to produce normal mice down the line. And this has been shown in so many different things, both in humans and animals, like stress that a mother feels, and certain animals will give rise to certain conditions down the line that become heritable, so that it's passed on. So women with the BRCA1 or 2 mutation, that only makes up about 10% of all the breast cancer, maybe even a little bit less, but they have an 82% lifetime risk of getting either breast or ovarian cancer. So this was really popularized after Angelina Jolie made the decision to have bilateral mastectomy. Dr. King published a paper where she looked at old serum samples and looked at women before 1940, before there was a host of all these environmental toxins that we're exposed to now that women back then weren't, that the risk of breast cancer was 24% if you were born before 1940, but 67% if you were born after 1940. Same thing held for ovarian cancer as well. So a lot of these environmental toxins that have been introduced since World War II have really predisposed to a number of things. So even if you have the gene for breast cancer, not all women develop it. And I have a huge number of men and women in my practice that are BRCA1 or 2 positive, that we do a lot of preventative things that I'm going to talk to you about over the next few minutes. Next slide. So Dr. Sheldon Feldman, Dr. Aronson, these are two doctors that have really pioneered looking at something called ductal lavage and breast milk, looking to see what kinds of toxins are in milk. So in mother's milk, you can find a host that are class 1 carcinogens, and these are stored, so it's really no wonder that these get stored in fatty tissue, and they stay there for decades and decades. Next slide. Toxic compounds are present in a huge number of samples of fat, whether it's from surgical patients or other patients, and they found that many of these toxins are present in very, very significant levels. So everybody has at least 80 to over 100 carcinogens that they're carrying in their body. I test people for mercury toxicity. We find it in about 30% of the people we test.